Welcome to our exploration of cardiovascular biology and disease. The cardiovascular system is central to human health, responsible for transporting blood, nutrients, and oxygen throughout the body. Understanding its biology is crucial for recognizing how diseases develop and affect our well-being. In this video, we'll journey from the basics of heart structure to the complexities of disease mechanisms, providing a comprehensive overview. Let's begin by looking at the heart's anatomy and its vital role in sustaining life, setting the stage for deeper insights into cardiovascular health. Heart is a muscular organ divided into four chambers, two atria and two ventricles. These chambers work together to pump blood efficiently, ensuring that oxygen-rich blood reaches every part of the body. The heart's valves prevent backflow, maintaining a one-way circulation. Its walls, especially the myocardium, are thick and strong, enabling powerful contractions. Understanding this structure helps us appreciate how the heart functions and why certain diseases can disrupt its delicate balance. Next, we'll explore how blood vessels complement the heart's work. Blood vessels form an intricate network connecting the heart to the rest of the body. Arteries carry oxygenated blood away from the heart, while veins return deoxygenated blood. Capillaries, the smallest vessels, facilitate exchange of gases, nutrients, and waste at the cellular level. This system ensures that every cell receives what it needs to function. Disruptions in this network can lead to various cardiovascular diseases, making it essential to understand how vessels operate and interact with the heart. Blood flow is regulated by the heart's rhythmic contractions and the elasticity of blood vessels. The cardiac cycle includes systole when the heart contracts and diastole when it relaxes. This cycle maintains consistent blood pressure and flow. Factors like vessel diameter and blood viscosity also influence circulation. When these dynamics are disturbed, it can result in hypertension or other cardiovascular issues. Understanding blood flow helps us recognize early signs of disease and the importance of maintaining healthy circulation. Cardiovascular system relies on specialized cells. Cardiomyocytes or heart muscle cells generate force for contractions. Endothelial cells line blood vessels, controlling permeability and blood flow. Smooth muscle cells regulate vessel diameter, affecting blood pressure. Red blood cells transport oxygen while white blood cells defend against pathogens. Platelets help with clotting. Each cell type plays a unique role and their dysfunction can lead to disease. Next, we'll see how these cells interact to maintain cardiovascular health. Our function is regulated by electrical signals originating from the sinoatrial node, known as the heart's natural pacemaker. These signals travel through the heart, prompting coordinated contractions. The autonomic nervous system adjusts heart rate and force in response to physical activity or stress. Hormones like adrenaline also influence heart function. Disruptions in electrical signaling can cause arrhythmias, highlighting the importance of proper regulation. Understanding these mechanisms helps us appreciate the complexity of cardiovascular biology. Cardiovascular diseases encompass a range of conditions affecting the heart and blood vessels. Common examples include coronary artery disease, heart failure, arrhythmias, and hypertension. These diseases can result from genetic factors, lifestyle choices, or environmental influences. Early detection and management are crucial for preventing complications. We'll now delve into specific types of cardiovascular diseases, starting with coronary artery disease, to understand their impact and underlying causes. Coronary artery disease occurs when the arteries supplying blood to the heart become narrowed or blocked, often due to a buildup of plaque. This reduces blood flow, leading to chest pain, shortness of breath, or even heart attacks. Risk factors include high cholesterol, smoking, obesity, and lack of exercise. Managing these risks through lifestyle changes and medication can help prevent disease progression. Next, we'll examine heart failure, another major cardiovascular condition. Heart failure means the heart can't pump blood efficiently, causing fatigue, fluid buildup, and shortness of breath. It can result from damage to the heart muscle, often following a heart attack or chronic high blood pressure. Treatment includes medications, lifestyle changes, and sometimes surgical interventions. Understanding heart failure's mechanisms helps us recognize its symptoms and the importance of early intervention. Next, let's look at arrhythmias and their effects on heart function. Arrhythmias are irregular heartbeats caused by disruptions in the heart's electrical system. They can be harmless or life-threatening depending on their severity. Symptoms include palpitations, dizziness, or fainting. Common types are atrial fibrillation and ventricular tachycardia. Treatments range from medications to procedures like ablation. Monitoring heart rhythm is vital for detecting arrhythmias early. Next, we'll discuss hypertension, a widespread cardiovascular risk factor. Hypertension, or high blood pressure, often develops without obvious symptoms but can damage blood vessels and organs over time. It increases the risk of heart attack, stroke, and kidney disease. Lifestyle factors like diet, exercise, and stress management play a key role in controlling blood pressure. Regular monitoring and medication may be necessary for some individuals. Understanding hypertension's impact helps us prioritize prevention and healthy habits. Atherosclerosis is the buildup of fatty deposits or plaques inside arteries. This process narrows vessels, restricting blood flow and increasing the risk of heart attack and stroke. Plaque formation is influenced by cholesterol levels, inflammation, and genetic factors. Preventing atherosclerosis involves managing cholesterol, eating a balanced diet, and staying active. Next, we'll explore how inflammation contributes to cardiovascular disease. Inflammation is a natural response to injury or infection, but chronic inflammation can damage blood vessels and promote plaque buildup. Conditions like obesity, diabetes, and autoimmune diseases increase inflammation, raising cardiovascular risk. Anti-inflammatory strategies, including healthy eating and stress reduction, support heart health. Understanding inflammation's role helps us target prevention and treatment more effectively. Next, let's look at genetic influences on cardiovascular disease. Genetic factors can predispose individuals to cardiovascular diseases. Family history, inherited conditions, and gene mutations influence risk. Some people may develop heart disease despite healthy lifestyles due to genetic susceptibility. Advances in genetic testing help identify high-risk individuals, enabling personalized prevention strategies. Understanding genetics empowers us to make informed choices and seek early intervention. Next, we'll discuss lifestyle modifications for cardiovascular health. Healthy lifestyle choices are fundamental for preventing cardiovascular disease. Regular exercise, balanced nutrition, avoiding tobacco, and managing stress all contribute to heart health. Small changes like walking daily or choosing whole foods can make a big difference. Maintaining a healthy weight and monitoring blood pressure are also important. Next, we'll explore how diet specifically impacts cardiovascular biology and disease risk. Diet plays a crucial role in cardiovascular health. Consuming fruits, vegetables, whole grains, and lean protein supports heart function. Limiting saturated fats, salt, and added sugars reduces disease risk. Omega-3 fatty acids found in fish are particularly beneficial. Nutrition not only prevents disease but can also help manage existing conditions. Next, we'll discuss the impact of physical activity on cardiovascular biology. Physical activity strengthens the heart, improves circulation, and lowers blood pressure. Regular exercise reduces inflammation and helps control weight, further decreasing cardiovascular risk. Activities like walking, swimming, and cycling are effective. Even moderate movement can have significant benefits. Next, we'll examine how stress affects the cardiovascular system and ways to manage it. Chronic stress triggers hormonal changes that can raise blood pressure and heart rate, increasing cardiovascular risk. Stress management techniques such as mindfulness, meditation, and deep breathing help protect the heart. Building supportive relationships and maintaining a positive outlook also contribute to resilience. Next, we'll look at diagnostic tools used to assess cardiovascular health and detect disease early. Doctors use various diagnostic tools to assess cardiovascular health. Electrocardiograms, ECG, echocardiograms, and blood tests provide valuable information about heart function and disease risk. Imaging techniques like CT scans and MRIs reveal structural abnormalities. Early diagnosis enables prompt treatment and better outcomes. Next, we'll discuss common treatments for cardiovascular diseases and how they improve patient quality of life. Treatment for cardiovascular diseases includes medications, lifestyle changes, and surgical procedures. Medications control blood pressure, cholesterol, and heart rhythm. Lifestyle modifications address underlying risk factors. In severe cases, interventions like angioplasty or bypass surgery restore blood flow. Personalized treatment plans improve outcomes and quality of life. Next, we'll explore advances in cardiovascular research and their impact on disease management. Research in cardiovascular biology has led to breakthroughs in understanding disease mechanisms and developing new treatments. Innovations include minimally invasive surgeries, advanced imaging, and novel medications. Genetic studies reveal risk factors and guide personalized therapies. Ongoing research promises even more effective prevention and management strategies. Next, we'll discuss the role of prevention in reducing cardiovascular disease burden. Preventing cardiovascular disease involves regular health checks, maintaining a healthy lifestyle, and managing risk factors. Education and community programs encourage healthy habits. Vaccinations and early screening help detect issues before they become serious. Prevention not only saves lives but also reduces healthcare costs. Next, we'll look at the global impact of cardiovascular disease and why it's a public health priority. Cardiovascular disease is the leading cause of death worldwide, affecting millions across all age groups. Its burden is highest in low and middle-income countries, where access to healthcare may be limited. Public health initiatives aim to reduce risk factors and improve treatment availability. Understanding the global impact highlights the importance of research, education, and policy. Next, we'll discuss the future of cardiovascular medicine and emerging trends. The future of cardiovascular medicine includes personalized therapies, digital health tools, and regenerative treatments. Advances in artificial intelligence and wearable devices enable real-time monitoring and early intervention. Stem cell research offers hope for repairing damaged heart tissue. These innovations promise better outcomes and improve quality of life. Next, we'll summarize key points and reinforce the importance of cardiovascular health. We've covered the essentials of cardiovascular biology, from heart anatomy to disease mechanisms and prevention strategies. Understanding how the heart and blood vessels function helps us recognize the importance of healthy habits and early intervention. Advances in research and medicine continue to improve outcomes for patients worldwide. Next, we'll provide practical tips for maintaining cardiovascular health in everyday life. Maintain cardiovascular health, focus on regular physical activity, balanced nutrition, and stress management. Monitor blood pressure and cholesterol and seek medical advice when needed. Avoid smoking and limit alcohol consumption. Building healthy routines and staying informed empowers you to protect your heart. Next, we'll discuss the importance of community and support in managing cardiovascular disease. Support from family, friends, and healthcare professionals is vital for managing cardiovascular disease. Community programs offer education, resources, and encouragement. Sharing experiences and learning from others fosters motivation and resilience. Next, we'll highlight the importance of ongoing research and how you can stay updated on cardiovascular health advancements. Keeping up with the latest research and guidelines helps you make informed decisions about cardiovascular health. Reliable sources include medical journals, healthcare providers, and public health organizations. Regular updates ensure you benefit from new treatments and prevention strategies. Next, we'll reflect on the journey through cardiovascular biology and disease, emphasizing lifelong learning. Our journey through cardiovascular biology and disease has highlighted the importance of understanding heart function, recognizing risk factors, and adopting healthy habits. Lifelong learning and proactive health management are essential for preventing disease and improving outcomes. As we conclude, remember that every step towards better heart health makes a difference. Next, we'll offer a final message of encouragement and hope. Cardiovascular health is a lifelong journey. By staying informed, making healthy choices, and seeking support, you can protect your heart and enjoy a vibrant life. Advances in science and medicine offer hope for better prevention and treatment. Take proactive steps today for a healthier tomorrow. Thank you for joining us on this exploration of cardiovascular biology and disease. Wishing you continued heart health and well-being.